Osteoarthritis and low trauma falls and fracture become increasingly common as we age. So it's important to maintain physical fitness. Make sure we engage in exercise to keep joints stable, but also in exercise program to maintain our balance and stability. However, at some point, people may require joint replacement. Joint replacements for hips and knees are increasingly common. You might say, well, what can I expect? Well, the first thing to say is, as far as hips go, the circumstances in which the requirement for hip replacement occurs is important. If it's what we call a planned or elective hip replacement, the results can be very good, but they're less good in emergency hip replacements as a result, for example, of a fall. This might simply be because people who fracture as a result of a fall tend to be generally less fit than people who have planned procedures. However, in both circumstances, up to a third of people do not regain their previous health status following the operation. Now, this is very variable and depends upon the pre-hip replacement activities, but also the expectations of the individual after the hip replacement and the level of activity prior to the hip replacement. People whom, for example, do sports prior to their hip replacement may continue to do them, but people do not tend to take up new sports after their hip replacement. Most people regain their previous health status within 6 months of the operation. But as we say, up to a third of people don't regain that previous health status. Proactive rehabilitation following the procedure is really important. Knee replacements tend to be a little more complicated and outcomes generally not quite as good as hip replacements. But once again, up to a third of people tend to be dissatisfied with the result of their operation. Again, this does depend on what people expect from their operation as a result of the procedure itself. So you need to think about realistic expectations. Knee replacements are very good for the reduction in pain, but appear to be not quite as good, for example, for resumption of mobility. Once again, health status tends to be regained by the majority of people within 3 to 6 months of the procedure. Motivation for rehabilitation and engaging with active rehabilitation after the procedure is extremely important in terms of regaining health status. Many of the dissatisfied customers, if you like, often complain of things which relate to quality of life rather than surgical outcomes from the procedure. Technically, operations are very good and the operations are very safe. Expectations of the procedure certainly need to be discussed with the surgeon prior to the procedure so that expectations can be adjusted accordingly. The number of hip and knee surgeries has escalated over the last 10 to 15 years. This may well be a good thing in that intervening in the disease process earlier might give people better outcomes for longer. Clearly, conservative treatments for arthritis are still the most important things. Weight maintenance, exercise and maintaining joint stability, and simple pain relief are all important. But when the time comes for hip replacement, perhaps an earlier replacement rather than later is better for quality of life.
Thank you so much for watching this episode of OLTV. If you liked what you saw and you want to watch more, like this video and subscribe to the Optima Living channel right here on YouTube.